Clinical supervision is supporting a pod of call handlers. So normally you get 5 call handlers per nurse. The patient phones up NHS 24, they're triaged by the call handler and they get an outcome of different outcomes. So you have a green outcome, a red outcome, so you've got your non-urgent, your urgent outcomes. Then we'll maybe ask a couple more questions, and if it's an emergency, we'll organise an ambulance. If it's not, we can advise the patient to go to the pharmacy, simple remedies, or we could advise them to go up to the A&E or the GP. It just depends on what the patient's calling up with and what symptoms they have. So the best bit about working with NHS 24 is that there's no day the same, there's no call that's the same, you're constantly learning. Even on your 8-week rota, you're getting 2 days where you're getting study time to go off and do some self-learning. You're working with an amazing team, you're working with physiotherapists, pharmacists, doctors, so you're constantly liaising with them and what would you do with this call, and you're constantly just learning. So I really love that because I come home with lots of new information every day. The rota is really important to me. It's an 8-week rolling rota, so I basically know my shifts years in advance if I stay in this same rota. So I'm able to plan, you're able to manage all your own annual leave, your days off, so I feel like that's really good, whereas in previous jobs I've had, it was all through the managers and you have to wait and it getting requested and you maybe only know what you're working 3 weeks in advance. So I think it's really good to hear that you are in control of what you're working. It does all come down to communication and just being confident in yourself to ask and know what you're asking as well and know why you're asking it. But yeah, communication's the biggest one, and just having to use the descriptive words and ask them like, where is your abdominal pain and exactly what does it look like, what does it feel like, because obviously we're not there to do all that. The most challenging part of being a clinical supervisor is you can't see the patient, so you're having to build up that image in your head. So when I first started here, they said it's basically like being in the wards but the patient's behind the curtain, and you're having to ask them and you're trying to build up that image in your head about what they look like what's their, you can't obviously do obs, so you're really trying to get them to describe every detail so you can see that vision in your head, so you're getting an accurate presentation of what the patient looks like, so you can triage over the phone. But that is the most difficult part, is just building that image and trying to see them